Hello, everyone. My name is Eric. I'm a fourth-year medical student from SUNY Downstate Medical Center from Brooklyn, New York. And today, we'd like to present our vision for the future of how healthcare should be managed, starting with LUTs. Here are the disclosures. I personally have none. This is a feasibility study to evaluate a new paradigm for the diagnosis and treatment of lower urinary tract symptoms using a mobile app, software platform, and remote patient monitoring. It is the first step of our objective to ultimately triage patients remotely, optimize quality, accuracy, and efficiency of office visits, substitute remote visits for office visits, and increase both patient and worker satisfaction. This is a prospective pilot study of men and women with LUTs who were asked to download and complete a mobile app, a validated questionnaire, and a bladder diary prior to the first visits. In our new paradigm, new urology referrals for LUTs were asked to complete a validated questionnaire and diary. Compliant patients are triaged by a physician extender in consultation with a urologist, and a working diagnosis is established. The patient is triaged to an urgent, routine, or remote visit. The mobile app is comprised of a questionnaire and diary, and the results are quantitated and displayed on a one-page summary. It is comprised of a total score of 6 subscores: voiding, storage, overactive bladder, incontinence, nocturia, and bother. The higher the number, the worse the severity. Scores in the red represent severe symptoms, the orange represents moderate, green represents normal. This woman on the right has severe polyuria, voided 19 times in 24 hours, and has a large capacity bladder. So she was offered a remote visit. And after excluding for remediable causes like diabetes, she was successfully managed with fluid restriction. Now contrast that with this patient here with terrible voiding symptoms, moderately severe overactive bladder symptoms, nocturia, and a lot of bother. Now look at his diary. His maximum voided volume is 84, which massively restricts how much he intakes. We're thinking that this patient is probably in near urinary retention or severe prostatic obstruction, and for that reason, we caught him in immediately. Now, due to the limited time here, I'm unable to go through the details of this slide, but the short of it is that 72% of patients elected remote visits and 28% elected for office visits. Limitations of this study include a small sample size, accuracy of preliminary diagnoses were not assessed, and complications associated with remote visits or inaccurate diagnoses were not addressed either. In summary, this study shows that the new paradigm is in fact feasible, and the results are very encouraging. Remote visits were achieved in 72% of patients and 8% of the entire cohort. Both physician and patient satisfaction were high. We believe this new paradigm will be a major benefit for healthcare because, first and foremost, it allows one provider to care for more patients, and patients will only need to come in when it is medically necessary. We also believe that office visits will be optimized due to prior knowledge gained through the app before the patient arrives, which will help enhance worker productivity, improve workflow, and reduce costs. Thank you.
Thank you for an interesting presentation.
Thank you.
We have time for some questions. I was a little bit curious about an issue we discussed before, and because it was 71 out of 201 that registered on the app.
Right.
And did you make any analysis between the groups that did use the app and those that didn't regarding educational level and social factors like socioeconomic?
That's a great question. Unfortunately, for this feasibility study, this pilot study, we did not, but that's definitely something we would definitely consider in the future studies that we hope to make.
Do you think that the use of an app could impair the quality of the care for the people that do not use it, or is it the other way around?
That's actually one of the things that we're hoping to evaluate in our future studies. But again, that's a great thing to consider and a factor to look at.
Okay. So what are your plans for the future?
Future to have a more extensive study with a larger population size, to incorporate more physicians in this app, and we'll go from there.
Okay, you have a lot of work to do then.
Thank you.
Okay, we have a question there.
We've been using this for the better part of 5 years, and this is the first time. This was done at Kaiser Permanente in California, which has a vested interest in remote visits. The way healthcare is practiced, in at least the state, the limiting factor for delivering high-quality care, in my judgment, is what we call the real estate. There isn't enough space to see all the patients. So that's what the long waiting list you can make up. You can hire more doctors, you can hire more nurses, but if you have no place to put them, it doesn't work. What this software does is it quantitates the patient's symptoms, and then when you add the diary, that one serves as a balance against the other, and then you can call in the more serious patients. No patient was told that they must have a remote visit. What they were told is that if you do the remote visit, we can start your diagnosis and treatment remotely. So the first lady, after making sure that he presented, after making sure that she didn't have diabetes or lithium toxicity or something, she was just given a behavioral program to reduce what she takes. The second patient, who had severe symptoms, 10 times in 24 hours with a maximum voided volume of only 84, he was called right in. And then when he was called in, we were prepared to do whatever was needed to be done. We knew that he'd need at least a uroflow and a residual urine, but we also scheduled him for left a slot for cystoscopy. He had invasive bladder cancer, and he would have not gotten into that system at Kaiser in a 3-month period because he had no hematuria, and because they don't do bladder diaries, he would just have been considered an ordinary man with prostatic obstruction.
So apps could really increase the availability to care. You mean?
Yes.
Yes. Thank you very much.
Thank you.